This is Will Spencer from the Renaissance of Men here for the Red Man Group. I'm here with Dr. Sean T. Smith and Ken Curry, the therapists. And we're going to have a discussion today about men and inner work, men and therapy, and I'm very grateful to be here with you guys today. So I'd like to start out the conversation by just giving the men in the audience and the men watching a sense of your backgrounds. You're both authors, speakers, men's groups. So just talk a little bit about your experience and your backgrounds. Let's start with you, Ken.
Sure. So I'm a licensed marriage and family therapist. I've been doing this work for about 15 years. The primary part of the work that I do is working with men, about 3/4 of it. So I have men's groups, and the other quarter of what I do is I work with couples, just helping them through marriage difficulties and that type of thing. I have some books that are available, and also on my website, solidman.com. I also have the different things that are available with my groups and an online community that I'm developing, the Solid Brotherhood. And so shout out to those guys if anybody's listening from the Solid Brotherhood. I also want to give a shout out to my grandson, Lucas. Today is his first birthday, so happy birthday, Lucas.
Thank you. And Sean?
I would also like to give a shout out to Lucas. Happy birthday.
Happy birthday, Lucas.
I'm a clinical psychologist. I've been in private practice for 16 years or so, and of course before that was many years of training. I worked in places like prisons and county jails, and I worked in Bosnia for a bit with an organization that exhumes mass graves and returns their bodies to the families and so forth. So quite a bit of kind of hardcore training. And private practice, I started out kind of specializing in anxiety disorders, because when you say you specialize in anxiety disorders, everything comes through the doors in the guise of an anxiety disorder. And over the years, I've taken on working with couples, which is fascinating work to try to help two people build something together or put something back on track. It's like playing chess. It's a wonderful challenge. And I also work quite a bit with men. The reason I found myself in this space is I wrote a book called The Tactical Guide to Women, which is about the standards that men might consider having when they're thinking about bringing a woman into their life as a partner. So here we are.
So I'm a man that's been very personally benefited by therapy, from men's groups and from individual work with a therapist. And I find that the men's space overall, the manosphere, the men's movement, whatever you'd like to call it, is really good at teaching men that they can work out many of their issues under a barbell. But the space isn't quite so good in saying that, well, maybe there are some things that can't be worked out through action that have to be worked out through talking, and that men are very resistant to opening up, very resistant in particular to seeing therapists, and perhaps sometimes for good reason. So I want to start the conversation by saying, what are some of the things that men who are considering therapy can potentially get out of the practice? Because I think part of it begins with men not understanding what therapy is for. So what are some of the benefits that men can hope to get from a good therapist? And we'll break down what that is going forward. So start with you, Ken.
Sure. I want to, actually, I'm going to go the opposite of where you're talking, because I do think there's a lot of benefit in men moving their bodies and doing things. I think of the how men process grief, especially, and that's why I'm bringing this up, because the way that men, for centuries, maybe millennia, when the way that we would process grief is we would do something. And so you think about it, back in the day, we would dig a 6-foot hole. We would build a coffin. We would slaughter the calf for all the people that are coming over for the funeral. There were really significant things that we would do as men that were significant, that was our process of moving our bodies and doing something significant that was part of our healing and dealing with grief. So I just wanted to reiterate that there's a really powerful part of us doing things as men to be able to deal with things that are deep going on with us. However, I do think where therapy comes into it, being able to talk through and process and tell the story and be able to reframe the story of what's actually going on is a really powerful part of our journey as men. And so being able to understand what is really happening rather than what we think is happening or what we've been told that is happening about who we are, about what's going on, about what's happening with the world. All those narratives and stories have been something that we've been told since we were brought out of the womb. Somebody's been telling us a story about what life is, who we are, and therapy, talk therapy in particular, is the whole thing of talking through that. What do you believe? Who are you? What's going on? What is this? What's happening inside of you? And being able to talk, there's something that is really significant with the power of words, being able to express words, being able to name things, being able to say what is going on, and having the challenge of what is that, and finding out the truth about what's really happening is a really, really profound part of our journey.
Mm-hmm.
Yeah.
Mm-hmm. And Sean?
Therapy is about creating options. It's all expanding your behavioral repertoire so that you're not driven by old autopilot behaviors.
Mm-hmm.
And putting words to it is a big piece of understanding the patterns that you're repeating in your life, and then creating some options around it. And I also am a huge proponent of moving your body and doing things as part of, particularly for men, as part of getting themselves on track. But you were talking, Ken, about men doing things when they were dealing with some kind of tragedy. Like there were things physically to do. Well, when do men talk? Men talk when they're doing things together. And part of that has gone away. And so there's a couple of things that are really important with therapy, is that piece of our lives to some extent has gone away, not entirely, but also there's a ton of research, and people have been piecing together this therapy process for decades now. And believe it or not, a good therapist is efficient and can get you down the road much more quickly than you're going to be able to do it by yourself. Now, you can do it by yourself, certainly. There's books and resources out there for everything, but somebody who really knows what they're doing, if you walk into a good therapist's office, even if you don't know exactly why you're walking in at first, the words are going to start to form around what it is that you're doing there. And we might as well jump into the topic of what do you look for when you go to a therapist? And one of the things you look for is during those first one or two sessions, do you come away with the sense that, okay, you got a clearer sense now of what the challenge is, and you have somebody who's aligned with you in helping you get over whatever it is that you're struggling with there.
So when you say aligned with what the challenge is, like unpack that, like what the individual goal that someone wants to accomplish in their life, or what they're up against that they don't know how to solve, like break apart challenge a little bit.
That a lot of times when people come to therapy, in individual therapy, Ken, you work more with groups. I work exclusively with individuals. And a lot of times people will come in, whether they're coming in individually or as a couple, and they don't know exactly what it is, but they know that something is not working. Something's not firing on all cylinders. And the first challenge is to start to build some words around that, so that you can actually put a handle on it and say, okay, this is the pattern that I'm struggling with here. And this is, eventually we want to get to the point where you can say, this is the part that belongs to me, this is the part that doesn't belong to me, and the part that belongs to me, I'm going to go after it like a pit bull. I'm going to tackle this thing, and I'm going to build some options for myself.
Mm-hmm. Do you see it working differently in couples counseling, couples therapy?
As far as what do you
in terms of like setting a goal up front?
Oh, by all means. I think that's one thing that that would definitely be a challenge I would lay ahead for anybody engaging in therapy, is being able to really think about, what do I want to accomplish? And if you're that would be one thing that as you discern if you want to work with a certain therapist, it would be, are they one who works with goals and wants you to move from point A to point B? I think a lot of times guys won't want to enter into therapy because, you think about this endless loop of how are you feeling, what's going on, tell me your story, whatever it is, without having a really significant goal. And I think, definitely working with couples, what do you want to accomplish? Where do you want to, when will we know when therapy's done? I think that's a really profound question that most therapists don't ask. And they don't pay attention to, this is when it's done. So we have, an idea of, here's when we're done. We're able to do 5 sessions, 8 sessions, whatever, but we know when we've made it to the goal that you've gotten. So yes, for sure.
Yeah, I like what you said about taking the therapeutic process and sort of making it something that you can kind of put your hands on. Because I think there's this image in popular culture, like, for example, The Sopranos. You know, there's Tony Soprano going into a therapist's office and manipulating that whole situation, and it sort of was this cultural entry of therapy into the cultural conversation. But it was very nebulous. It wasn't really well defined, where this is what I hope to achieve and this is what I want to get out of it. It was just like, I'm just here to talk about my issues. And then it didn't show what therapy is really about, and created sort of the wrong impression for a lot of men who walked away thinking that, oh, this is what therapy is, and it's kind of nothing, right? It's a chance to take advantage or something like that.
Well, I'm going to jump in there because, there is a place for, we're going to set some specific goals and we're going to try to get there. But then there's also a place for therapy that is more open-ended, like Dr.
Agreed.
Melfi, you know, and so a lot of intensity happened between Tony Soprano and Dr. Melfi. And I'm not saying it's a great example of great therapy, but that open-ended of the man going in and saying, I don't really know what's going on. The ducks are bothering me. I can't really wrap my head around this. I need you to help me put some words to it. That's where it started with them, if I recall correctly. And it unfolded over a long period of time where she was just helping him. She was being manipulated by him, but she was also helping him put words to his experience and helping him see some things that she knew he was seeing but wasn't acknowledging, like his mother trying to off him, for example. She saw it before he did, and that made him furious. But that's the sort of thing that good therapy can also do, which is just, let's look at what's going on and put words to it.
So it's kind of this room for both. There's like, well, this is what I hope to achieve, and also I don't really know why I'm here, but I need to talk to somebody about what's going on. Yeah,
and a lot of the work I've done has been very goal-oriented. Like, I need to know how to ride an elevator because it's really interfering with my life. So there's a specific goal, and we have a very specific way of attacking that. But there's other ways to work too.
Yeah, and I think, Will, I was kind of thinking, kind of pushing the goal, because I totally am with Sean. There's times when it's important to let this out and talk it through, and let the stuff that's been packing in my life for so long, I need to unpack it and let it and tell my story, and maybe there wouldn't be a specific goal or outcome that I'm looking for. But I think the biggest thing that why I'm pushing the whole idea of goal, or even saying that, is there's a really significant level of hesitancy for men to move into therapy because we think it'll just be this endless loop. And I think being able to, especially as you go into it going, I have a little bit of, not a little bit, you have a lot of authority as you move into the therapeutic process to be able to guide it how you want it to go. And if you don't want it to be something that is just an endless loop of talking about stuff, and you want it to be something that's more goal-oriented, you have the capability of making that happen. And so I think that's why I was kind of pushing in on that, but I'm totally with Sean as well.
Yeah, there's sort of like a tension of opposites where you could have sort of a goal-oriented approach to it, and that's totally valid, where you can also have just kind of an open-ended approach, and there can be room for both. There can be like some days that may be more goal-oriented. Like in my therapeutic process, there were some days where I was dealing with a specific thing, and then there were other days where I was just like, I'm just going to take this apart and just kind of riff for a while until the thing that comes up that I'm really dealing with. And so you kind of have to hold that tension of opposites. Like, it can be this, but it can also be this, and there needs to be room for both. So since we're on the subject, Tony Soprano saw a female therapist, and Sean, you and I had talked about this before the panel about whether men should see female therapists or not, and this seems like a good place to jump in. You know, the therapeutic profession is heavily female. Should men be seeing female therapists, or should they be looking only for male therapists? Or both?
That's a tough question because the profession, the profession is so dominated by not just women, but dominated by feminist ideology. And so to answer the question, I guess you really have to back up and ask, okay, what is good therapy? How do you identify a good therapist, and then how do you weed out the ideologues? Because that, unfortunately, is an extra challenge for men, that you need to make sure you're working with somebody who isn't trying to push something on you. And we have organizations like the American Psychological Association that is openly instructing psychology students to push a political agenda on their patients, basically. And it's just unbelievably unethical. But all that aside, should a man see a female therapist? Yeah, it depends. If part of what you're struggling with is that you have the same old experiences with women over and over and over. Maybe women have never worked out well from you, starting with the ones that you grew up around. And if you think of the therapeutic relationship as a relationship, then one of the things that's going to happen is the patterns that you have been enacting out in the world are going to show up in the therapy room. And if those patterns center on women, then okay, it's going to show up. And if it shows up with a man, that's fine. A man's going to be able to identify it. But if it shows up with a woman, and if it shows up with a woman who is, number one, skilled and regards herself as someone who has pride in her skill set in her profession, and number two, is actually doing the job and not trying to push an agenda, which I guess would fall under skills, then when that pattern shows up in the therapy room, I mean, that's where the gold is. That's where she'll be able to say, all right, I see something happening here. Do you see something happening here? Let's put it under the microscope and check it out. And for that to be able to happen with a woman might be magic for that guy.
You concur with that, sounds like?
Well, to a degree,
Okay.
yes. No, if what Sean's talking about, if this woman has that skill set, not a problem. I'm just questioning, I would question which women have a skill set to do that.
Which therapists in general have, because
Exactly.
we were talking earlier about how so many men in the profession have been feminized and
As well.
yeah.
Yeah.
Sorry, go ahead.
And so, no, but it's also, so I agree, and that's just part of the vetting process of a therapist. But as far as, I think generally, generally a man, most of us wrestle with the whole idea of in our lives putting women in a position to where they're the golden-haired goddess, or they're on a pedestal, or they're the one that provides us with our identity and our well-being and my value, and they knight us with our manhood. And so we have given women that space to give us this. I mean, this is a big part of the No More Mr. Nice Guy with Dr. Robert Glover, the whole idea of external validation, where I don't have a strong sense of self, so I need something outside of me to be able to provide that for me. And many of us, if not most of us, have looked to women to be able to provide that for us. And so when we do have a female therapist, it's like she is, and she represents that golden-haired goddess oftentimes. And so it's like that becomes a problem. And so I think, so my challenge would be, yes, if you can find a therapist, and this is what's so hard, because like we said, so many therapists are women now, and it's really hard to find a good male therapist anyway. And so if you're, you'd really have to check yourself. Is what I'm looking for is validation from a woman, and therefore that's why I'm choosing a female therapist? That's going to be a massive problem, and it'll be really difficult to deal with that problem, because trust me, that problem of having that external validation and needing that from a woman is a primary problem that you need to be able to overcome. And the question would be, can I do that with a female therapist?
And if she's a good therapist, she's going to pick up on that like that.
Like
and
that.
she's going to be able to help you notice it. She's a bad therapist, she's just going to get drawn into your old pattern.
Right into it.
You know, I'd given some thought to this, and I had seen female therapists for many years and had never made any progress. And I saw a male therapist and made very rapid progress. And I had landed on the side of, okay, I think men should see male therapists, but women should see female therapists. But listening to you guys talk, I can sort of see that, you know, especially considering the socio-political situation in the country and in the therapeutic profession, that maybe the priority shouldn't be on the sex of the therapist, but the quality and the skill of the therapist. And if you can find a good therapist, go to see that good therapist and ignore everything else, because finding a skilled therapist who will be, let's say, sympathetic to men is an increasing challenge. And if you find whichever sex they are, like, go for that one.
Yeah, and I would say there's, because we're kind of talking about a therapist who's going to be working on a pretty significant part of your life. Yeah. Trust me, I know a lot of really competent female therapists. I work with a number of them. There's a lot of amazing women therapists.
Sure.
I'm not going to say that that's not the case. But if you're working with trauma, and let's say you need to do a season of EMDR or something like that, if it's something that is a season of something, I think that's totally fair to be able to pursue a female therapist. But like I said, if it's that core issue of my identity and what I believe about myself, then I'd really do my best to try and find a good male therapist for sure.
Well, so let's go into now I'm going to ask the hard question of the day. how can someone find a good therapist and how can someone find a good male therapist? And you could take either of those questions or both. We'll kick it over to Sean.
Okay. I need a minute to think about this, because this is a really tough question. It's almost two questions. Well, how do you find a good therapist? And then how do you find one that hasn't been poisoned by ideology, which unfortunately, I think it's one of the biggest problems in the profession right now. And I think one of the ways to start, there's the internet that will help you find people in your neighborhood to see. But then I think really the way to find that good therapist is to sit through a session and observe them. And there are some things you should look for. There are a few questions you should ask. I don't think that interrogating the therapist is going to get you very far, because it's better to watch what they do and how they do it. There's one question that I think everybody should be asking right now when they go to see a therapist, and that is a question: what social or political issues do you think it is important to discuss with your clients? And it's a trick question, of course, because the answer is none. I work for you, and I'm here to work on your agenda. If there's any other answer than that, then just walk out at that moment. But
that's great.
Then beyond that, looking at that first session and just getting a sense of, okay, how do I feel when I walk out of here? Am I walking out feeling like I have a better sense of where I'm going? Is the problem contained a little bit better? And it may take a long time it shouldn't take too long to define the problem, but it may take more than one session. But really watching the person in that first session and seeing what they're focused on. Are they focused on trying to identify the problem? Or maybe you've already identified the problem. So then are they focused on trying to understand that problem? That's what you should be walking out, is a sense that, this person's on my side and they understand what I'm trying to accomplish. And at least so far, it feels like they have the skill to get me a little bit further down the road.
So now for Ken, so there's a couple questions I want you to tag onto that, like the questions that a patient or a client should be asking a therapist in the first session, but also, if you could comment after that about how to even find one, like in the phone book or on the internet or something like that, like what the actual, I guess you might say, technical process of finding a person would be. But after you answer the question of, once you get into the office, or even before, once you're in email or something like that, how does that whole process go? Let's break that down.
Yeah, it's really, really, and I love Sean's questions. Those are really, really important. I think because there's a number of ways that you can find it, a therapist in your neighborhood, Psychology Today, and some other categories that or online things that really help you to be able to find somebody. It always starts with either an email or a phone call or that type of thing. I think probably the most important thing, besides what Sean was talking about, because it's really important to vet this person. Is this person a person who is going to respect me as a man, respecting masculinity, not disrespecting me as a man, being willing to empower me as a man? I think that's a really significant question. What do you think about the concept of empowering men? I think if they go, I'm all for it, then great. But I think the most important part of this whole thing, as you vet this person, is listening to your internal intuition. Your gut is going to tell you the things. Sean was kind of talking about, going through a session and being able to listen and see and how do they move. Your intuitive is going to show you and tell you there's something going on here that's not quite right, or there's something going on that's exactly what I need. Your gut's going to tell you exactly if this is the person that you want to work with. And so you really have to listen to your intuitive process as you're working through this, especially on the front end. If you feel like there's a red flag or there's something going on, then listen to that and go, what is that? Why do I hesitate? Or why do I not want to open up? Or why does this feel like I can't really trust this person? That's going to be a really important part of this process, because you have to remember that you are the one that's in charge of the process. You don't have to hire this person. You can fire them after the first session or the second or the third session. You're in control of this. You don't have to lock in and say, okay, we're in it for 6 months. You can say, all right, this isn't working out for me because I don't feel like this is a good fit. That's a really important part of this whole thing, for sure, listening to your intuitive.
Yeah, that first session should feel very different than talking to a friend or a bartender. And it should feel different in a good way. You should walk out feeling a little tired, and you should walk out feeling pretty good.
I guess.
Can I say? I'll
yeah.
just say the tired thing.
Mhm.
That concept of you should feel tired. Trust me, the work that you're going to do in therapy, it's emotional work, and it will exhaust you. And it is something. It's really tough, exhausting work. And I think that's a great. I like how Sean said that. You should feel a level of exhaustion, because if you've done good work, you're going to feel something heavy as you move out of the office that day.
So I think I want to find a way to draw a distinction or put some nuance into. So a man goes into a therapist's office and how to differentiate between when his intuition is telling him that something is off versus his own perhaps natural instinct to avoid doing the work, right? Because I can imagine a man getting into a situation being like telling himself that something is off when in fact he's just trying to avoid confronting something within himself. How can a man know whether that is a true instinct?
Yeah, that's interesting because, like, how Sean just used the illustration of a man or a person needing work to be able, or help to be able to go on an elevator, and it's the same thing. Mm-hmm. It's like when you go into therapy, the thing about it is you are going to be required to open up. You're going to have to tell your story. You're going to have to reveal your fears. You're going to have to talk about what's really going on inside. And so it's equally, if not as fearful as anything you've ever experienced in your life. Like if I'm fearful of going on an elevator or an airplane or spiders or whatever, you're going to feel it. And so that's a really good question, Will, because it's like you're going to feel the need to close off, or, oh my gosh, I'm opening up too much, or I don't want to do this, or this feels dangerous. Man, that is good, because it's like the difference between the two of listening to your gut and listening to what's going on with your fear, it's not far off. Mm-hmm. And so you're not, and it's not comfortable. And so, man, I don't know how to answer that, because it's like, it's so close. Mm-hmm. That's a great question.
Yeah. John?
I think whenever you have something like that where you're ambivalent, the answer, usually a useful answer is collect more data. Like, give yourself permission to not have to answer this question right now. I'm going to collect a little more data. I'm going to check it out, and then maybe it starts to clarify for me.
Mm-hmm. So give it some time to kind of process.
Yeah. Don't
make a call right away.
Yeah.
So this brings up the question, you mentioned openness. This brings up, and we were talking about this at lunch, the question of vulnerability, both being vulnerable and the word vulnerability itself as something that sort of has a kind of charge around it. Like there's nothing directionally wrong with the word, let's say, but the way that it's kind of used doesn't serve men. So I wonder if we can just unpack that a little bit, because it seems like it's being misused in so many ways.
Yeah, there's no doubt it's been misused, and it's been misused as if a man is vulnerable, then he's weak. A man is feminine, or a man is submissive. All those types of words kind of come up with the word vulnerability. I like to think of it as it's very close to the word courage. It takes a hell of a lot of courage to be open and vulnerable. And so courage is not a problem when we talk about masculine values or virtues. Courage is always one of the highest values or virtues. And so when we go to open ourselves up, it takes a hell of a lot of courage to be able to go to that space that is scary as hell, that I don't know what to do with, that opens myself up to massive amounts of uncertainty. And it's something I've hidden away and I've tucked away and I don't want to look at. And it's scary, and it takes a hell of a lot of courage to be able to do that. And I would call that vulnerability. But to your point, vulnerability feels like a really dangerous word, because I'm like opening myself up to be killed or to be harmed or whatever. And that's what it feels like. I think when you do open yourself up and start telling your story about what's really going on with another human being, it feels like that. It feels dangerous. It feels like, what the hell what's gonna happen here? But to be able to really deal with your shit, you gotta open it up and go, what is in here? Because every one of us are carrying a hell of a lot of stuff. And so in order to be able to process it and to be able to think about, what is this? What is my pain? What is my trauma? What is the things that I'm afraid of? why am I anxious about this? Whatever it is, you have to go into that space, and it takes a lot of courage to go there.
Sean?
About vulnerability?
Yes. Yeah.
I was thinking a little earlier today that in all my 20 years I've been doing this in one form or another, longer than that actually, I don't think the word vulnerable has ever come up in any meaningful way in my career, unless it's talking about an army's vulnerability or something. But never in this sense. It's just kind of an irrelevant word, as far as I'm concerned.
Great.
We're here to do some work, and the work's not going to be easy. So are you up for the job or not? Mm-hmm. That's all there is.
That's great. And even saying the word vulnerability, I'm kind of aware of, how heavily politicized, how that word is essentially used as a weapon now. Like, men need to be more vulnerable. And they're not saying it, people who say things like that, they're not necessarily saying it in a way that's like, no, this is to benefit men. It's actually, the feeling is if it's to weaken men. Yeah. It's like, maybe we could set that word aside and come up with our own language about how men can best take advantage of openness and bring the tactical virtues of, like you said, courage. Well, there's an honor in openness as well. Like, no, this is honorable for me to go and deal with my shit. This will help me show up better as a man, help me be more honorable, help me be more masterful in my life. And certainly it takes strength. So maybe there's a way to frame it. It's like, no, this is a very masculine pursuit to deal with the inner work and to fight those inner battles, to set aside the word vulnerability altogether.
Ken, I think I heard you say something earlier today. Correct me if I'm wrong, but when a wife is asking a husband, a significant other is asking her man to be more vulnerable, what she's actually asking for is, will you just talk to me?
Just tell me what the hell's going on inside of you.
But we hear it as bare your belly and that I can gut you. And, and that is some guy's experience. But
Exactly. But it is. She just wants to know, what are you feeling right now? Yeah. What are you experiencing today? That's all she wants. And even that, this is what I'm feeling. This is what happened today. This is what I want. Just the simple things. Even that is vulnerable, because what is she going to do with that? It's an openness, but it's what is she going to do with it?
Mm-hmm. Well, this openness, vulnerability, you mentioned intuition. I find that a lot of men, and this was certainly my experience for a long time, didn't really have a good sense of what was going on in them beneath the level of the neck. It's like, what's going on in this? It's kind of a big, I'm either cut off from it, or it's either a big soup of things that I can't separate one from the other, and intuition and feeling kind of go together with that. And how can, and Sean, I know you and I have talked about the nature of intuition. How can men begin taking apart the things that are actually going on in their body in terms of emotions and feelings to develop the language to have these conversations?
I think one of the things that's really helpful with guys regarding intuition is to just think of it as nonverbal information processing. And I got this idea from a paper that was written in 2000 by a researcher, kind of a rock star researcher named Matthew Lieberman. And he talked about that is essentially what it is, that we have lots of things bubbling in our mind, our brains all the time. The brain is a modular organ, and we have parts that are verbal and we have parts that are nonverbal. And the parts that are nonverbal are still noticing things because information is bubbling up through the reticular system, and some of it's being filtered out and some of it isn't. But some of it gets filtered into nonverbal parts of the brain. This is being very sloppy in my language here, but those nonverbal parts of the brain are going to speak to us nonverbally. So we're going to have an increased heart rate, we're going to have butterflies in our stomach or whatever it is. But this is a nice, scientific, accurate way to think about what intuition is. It takes the mysticism out of it for anyone who's uncomfortable with mysticism. If you like the mysticism, you can add that back in. But you can start with the scientific basis of this is what it is, and this is how it works. You can listen to it or you can not listen to it.
Ken?
No.
You get to follow that. I'm not taking that one. There's too much good stuff in there.
No, I just the concept of being an integrated man comes to mind.
Yeah.
So so many of us are so stuck in our head, and we're just here. We think about it, we process stuff, we get the analysis paralysis, and like you said, the neck down becomes fairly irrelevant, where we're not listening to this. Mm-hmm. And so whether I love the idea, Sean, you're talking about that nonverbal, all the language that comes to us nonverbally from our body, or from our intuition, or instinctive, or even you think about a good humor comes from underneath and comes out. And there's so many things that are going on under the neck, below the neck, that are just our spirit, our heart, our the things that are our soul, and different things down here that we're not integrated with, we're not connected with. And I think that's probably one of the most profound parts of therapy to me, is reconnecting a man with himself. And I think that's a really, really significant part of the therapeutic work, is so many of us are disconnected from ourselves. And so being able to reconnect, intuitively and all the different categories that we have, our emotions are a really big part of it that we're disconnected with. And I think that's a big deal. But I'm trying to connect that with what Sean just said. I don't know how, but
I think I see what you're saying. I mean, it's learning to, like, we're used to thinking thoughts in our head in language about our lives or whatever's going on in front of us. And I like the way that you put it, Sean, where there's information, coming up from the nonverbal parts of the body, from the body essentially, and it filters into the nonverbal parts of the brain that then communicates with us nonverbally. I really like that image, because it makes sense. Like, why something's happening with my sense over here. It's intuition. My body is somehow picking up information that I can't quite put words to, but I'm still perceiving it in a nonverbal kind of way. And learning to listen, that seems quite easy to do once you know that that's what's going on. Your body interpreting language through the mechanism of your brain, I guess you might say.
There was this American, I guess you'd call him a psychologist, philosopher. His name was William James, and he came up with this theory of emotion. It's called the James Lang, two different people, theory of emotion. And his idea was that not that we're running because we're scared, but we're scared because we're running, meaning that we see ourselves doing something physically and then we respond to it emotionally. Okay. And for a long time, psychology kind of poo-pooed that, thought it was kind of a silly notion. But there's been some compelling research that has come out and said it's a two-way street, that William James was correct, that yes, we are scared because we're running, and we're running because we're scared. It's a two-way street. And so as information is coming in through your senses, parts of your brain are going to activate parts of your body. And then other parts of your brain are going to notice that your body's activated. And there's these two-way streets going all over the place. And that's where you get the choice, because all of this stuff is going on. All of this two-way information between your brain and your body is going on. You can listen to it or you can ignore it. Now, most guys who are disconnected from it, like I was, they come by it honestly, because if you're raised around traditional men and something happens to you, they're going to tell you to rub some dirt on it and keep going, which is an unbelievably important skill to have. Yes. We just have to make sure that we don't lose the other side of it, which is that, yeah, we're going to rub some dirt on it, but we're also going to pay attention to everything that's going on to the best we can.
What I think is really interesting is, I know that you're very well-versed in the clinical literature, scientific clinical literature, and Ken, you and I have talked a lot about Christianity and faith, and so I'm dealing with that duality, and I really want to get into that, but before we get there, you talked about traditional masculinity, rub dirt on it, and that just makes me think of the whole thing that's going on with the APA that I feel like we have to talk about first, because it's kind of the water that we're swimming in, and before we can get to the science and faith conversation, I just want to talk about the APA and what it's trying to do to traditional masculinity, while we're here, and then we'll move on to other more interesting subjects, I guess.
More interesting.
I mean,
that's a big deal.
It's unpacking to see the expression of things that are going on throughout our culture,
right,
in the way that it's taking a unique expression within the APA, and so it's interesting in the expression of it. But for what it is, it's like, oh, that again, So let's just talk about it now and let them go away.
A little context. The APA has been overtaken by political ideology. I guess you call it political radical feminism, essentially. And a couple years ago, they put out these guidelines for working with boys and men. And I think a reasonable assessment of those...
Wait a second.
Yeah.
I think you need to say, what is APA?
Oh
yeah, that might be important.
The American Psychological Association. Thank you. Yeah, and they are... What are they? They are not a governing body per se. They are a professional organization. And the reason they have clout as a professional organization is that they are the go-to organization for accreditation. So if you have a training program for shrinks and you want your students to be taken seriously in the marketplace, you will seek APA accreditation. That's ultimately where their power lies. And they wield a tremendous amount of power because of that. And they also are influential legislatively and, and within the states. So thank you. That's the APA. They periodically put out these treatment guidelines, and most of them most of them are frankly kind of boring. Like they're not very interesting. Like treatment guidelines for schizophrenia. Here's what they'll say. Here's what the current thinking is on how schizophrenia operates, and here are the standards that psychologists should be striving for in treating this thing. And you'll have treatment guidelines for all kinds of things. Every once in a while, treatment guidelines for all kinds of conditions and particular situations. Every once in a while, they will veer into a more political slant where they will have treatment guidelines for working with girls and women, treatment guidelines for working with this demographic group or that demographic group. And a few years ago, they came up with the guidelines for working with boys and men. Mm-hmm. And these guidelines, I think a fair assessment of them is that there are some good points in the guidelines. For example, they acknowledge the importance of fatherhood, and they acknowledge that children do better when they have fathers. So that was that. I don't know if that was a painful admission for them or not, but they said it. Yeah. Primarily, these guidelines were a way of advancing feminist ideology in the clinic. And so what was the question? I talked.
I just help men understand what the APA guidelines are, right, what their intentions are, how the whole thing works that they're trying to do through the therapeutic professions.
Right. So there's this line that they became infamous for, and it wasn't in the guidelines, it was in the APA's article about the guidelines in the APA Monitor, and they said that traditional masculinity marked by, I'm going to get these out of order, but there's stoicism, competitiveness, aggression, dominance. Well, you get the idea.
Yeah.
That they are inherently bad. That they are, what was the exact phrasing? That they
competition.
Competition, yes,
yeah.
Thank you. That these are on the whole harmful, rather than saying, okay, something like stoicism. We were just talking about stoicism. A little boy gets hurt. His dad says, rub some dirt on it. What that man is teaching that son is, right now there's a job to do, and I need you to manage your emotions. And that obviously can be taken too far. That can degenerate into all kinds of problems like alcoholism, compulsive gambling, you name it. But there's this complete failure to recognize that there's a positive side to stoicism and competitive and aggression and what were the other ones? I don't know. Whatever they are.
Dominance.
Yeah. There's a positive side and a negative side. They only see the negative, and if you're being stoic or competitive or aggressive or any of these things, you are toxically masculine, and you're mentally ill, basically. I don't think that's overstating it.
And it's the therapist's work to remove those categories.
Yes, thank you. Yes,
out of your life.
We have to fix you.
We have to fix you.
Yeah.
You cannot be so stoic.
Squeeze that masculinity out of you. Make you obedient, domesticated.
Domesticated.
Yes.
Absolutely.
Yeah.
I mean, what you guys are saying, you're joking about it, but no, this is very real. Like, there are therapists that do this. They take this as their professional obligation to squeeze the masculinity and those 5 characteristics out of men in the office, in the therapeutic process, that they think that's their job.
One of the primary authors of the guidelines said in this Monitor piece about the guidelines, he said, if we can change men, we can change the world. Meaning, I take that to mean one man at a time, they're going to domesticate us. And they're going to change the world into, I don't know what his vision of the world is, but
right.
It's not my vision, I can tell you that.
But I would totally agree. If we can change men, we can change the world.
Yeah. The principle's valid, but like maybe the way you're doing it, not so much.
Not so much.
Well, but there was a way, and Sean, you explained this to me when we had talked previously, how they're using those characteristics specifically to achieve their goals. Maybe you can just sort of share that with the men, because I found that to be the most like kind of thing.
What did I say? I might have been drunk at the time. What was I talking about?
We might have both been. So you were saying that the way that the guidelines are framed is that men need to use stoicism, aggression, competitiveness, and dominance to undermine, which are the core tenets of masculinity, to undermine masculinity itself. So they're supposed to take these characteristics and apply them for the purposes of destroying masculinity.
Yeah. What you said.
Yeah, that's just. I mean,
Sean, say it in your words.
Yeah, you say it.
He said. I think you said it. Yeah. I would just be repeating what you said. Yeah.
You can do that.
Okay.
No, I mean, just kind of. You must see this. This must be real with people in your professional network or therapists that you know casually. Like, do they actually believe this? That's the part that I want to tie together.
No.
Okay.
There is this Ken, tell me if you agree. There's a pretty clear, bright line between the academic and administrative side of psychology, which would be professors and people who want to be in the APA and tell other people what to do, and then just nuts and bolts clinicians like me.
Mm-hmm.
A big difference. And I know so many women clinicians who are really good clinicians, and they don't buy into this. And the reason they don't buy into this is because they're working with human beings on a day-to-day basis. And when you're sitting across from a man who's telling you that he's doing the best he can in his marriage, and here's what he's tried, and here's where he's failing, and you're actually seeing a three-dimensional human being instead of a cardboard cutout defined by some ideology, it's very hard to buy into an ideology that turns men into two-dimensional creatures.
So there's this disconnect between the sort of the high-level guidelines and the on-the-ground practice for most practitioners?
For most practitioners. Now, when you get into big agencies, like I can use prisons because I was in the prison. I worked in the prison system. Not that there's anything wrong with being in the prison system. It helps some guys. But when you get into that kind of agency work, then you encounter these administrative bureaucratic types who want to impose this ideology. Because the kind of person who aspires to be at the top of a bureaucracy is the kind of person that's going to do these bureaucratic things and try to lord it over people, and they have their ideology, and they have succeeded in that bureaucracy because they have the correct ideology. So they're going to make sure that the people they're supervising are pushing it onto their patients.
So in the setting where you have men who are potentially the most vulnerable or the most in need, they're the ones most likely to be receiving these guidelines and the impact of them.
That has always been the case, hasn't it? Throughout time. The men who are the most vulnerable are the ones who pay the price.
Wow. Ken, is this something that you see in your professional networks and obviously not in your practice, but in the therapists that you know? So the people, therapists specifically, dealing with the guidelines and rejecting them, accepting them,
Yeah, I think when Sean used the term nuts and bolts, or whether you're a pragmatist, where you're trying to find what works because you're wanting to help people. I think most people who are therapists, doesn't matter who they are, they actually have a heart and they want to help individuals or families or couples to be able to succeed. I think that's kind of a given. It's a good thing, I do think there's a number of people that are bought into the ideology, but I think for the vast majority of people, they're just wanting to find out how can we actually help people grow and help people succeed and help people overcome their difficulties. I think that's probably it. So I think the whole nuts and bolts thing is real, because it's like the ideologies that the story, the narrative that's being told about us as men is so much bunk. It's total BS.
Total crap.
It's ridiculously wrong.
Yeah.
And it totally, the whole thing of, that we're, all that is just the whole toxic thing. I mean, it's just ridiculously so wrong. It's such a lie. It's a false narrative. It's not the truth. And so I think when people are actually wanting to make a difference, they can't listen to that stuff. They have to they realize that there's something else going on. I mean, it's the same thing as you see with the pickup artist world, where they go, women actually like strong men. They're actually attracted to a confident individual. How about that? And so it's like they actually like a man who has these toxic masculinity attributes. And so therapists are the same way. They're finding out, okay, what is the thing that actually works for a lot of them. So
I want to introduce some nuance and maybe push a little bit. So the APA guidelines frame masculinity as the problem. We here at the 21 Convention, Red Man Group, and many men in the space regard masculinity as the solution. Are there therapists that are outside of present company accepted that are recognizing masculinity as the solution? Because it's one thing to say, I won't demonize masculinity. It's one thing for a therapist to say, no, masculinity is fine. It's another thing for a therapist, man or woman, to say, no, masculinity is restorative, curative. And to recognize that. Are there therapists, present company? There are.
Yeah.
That's, okay, please, more, share.
Well, one man that comes to mind is a guy named John Barry. He's out of the UK. And he's very much saying what you're saying, that things are out of balance. He's not anti-women any more than we are anti-women.
Right. And there's a difference between pro-men and anti-women, right?
Yes, absolutely.
Not zero-sum.
And he's saying that things have gotten out of balance in our profession, things have gotten out of balance in the legal profession, and we need to restore some of the balance. And he's put out a couple of great handbooks, and a handbook is a collection of research articles, essentially. And he's put out a couple of great books that look at the benefits of masculinity and how necessary it is. And I don't know why that should be controversial. And if somebody put out a handbook on why femininity is a necessary force in humanity, that would not be controversial. But anyway, there's him, and I'm going to draw blanks on other names, but they are out there.
Yeah. And you know of some as well?
Yes, but nothing's coming to mind.
Well, that's really great to hear, because because it would seem that so many institutions, and with the APA guidelines included, that so many of the institutions are captured, right? That they're just monolithically captured with a feminist or other forms of ideology. But it sounds to me what you're describing is maybe things aren't quite so monolithic within the profession itself, within the institution itself. That maybe there are some that regard masculinity as toxic or destructive, and others who regard no, this is actually a solution, and there's some conflict going on behind the scenes, which I think is fundamentally a good thing, that tension versus some sort of monolithic belief.
Yeah. Things are rarely as bad as they look until they're 100% worse than they look. Then, yeah.
Okay.
No, my thought came to the whole idea of the concept of Mother Nature bats last.
Oh, wow.
When it really comes down to it, what is natural? What do we as humans actually, kind of like what I was saying, when it comes down to a feminine woman, she wants a competent, confident, strong man in her life. And so you think about that. Okay, why would that be a natural movement of a feminine woman? It's because nature is inside of us. And all of us, we're feeling the natural movement of masculinity inside our soul, inside our body, inside our instinctive, that's basically saying, this is what I want to be. And I think the culture is kind of, there's so many crazy things that are culture, the narratives and the stories that are being told that are just, you're going, that's insane.
Yeah.
But when all the stories have been told and all the stuff's been done, when it really comes down to it, nature is going to bat last. And nature is going to be shining bright. And so it's like, gosh, I don't know what I'm saying with that.
No, it's brilliant. Well, you're kind of reading my yeah, no, you're actually you're actually reading my mind, because we're talking about men's natures, masculinity being restorative, the sort of conflict that's brewing in culture between different ideologies. And I'm thinking, here we are at the 21 convention, having this discussion around men that are pursuing masculinity, and here with a couple of therapists, which you might not think would be part of this community, but you are. And so I wanted to get your perspective on the manosphere or the Renaissance or the men's movement or whatever you want to call it, what you guys see your roles maybe personally are, or the role of therapists or the role of inner work, because it seems like it's not something that's widely talked about, but it's something that I think is really vital for men to confront, as much as going to do hard things, like go do hard shit, and in the category of hard shit is therapy, and that's something that needs to be done. So I want to speak to the larger, let's say, men's movement community in the role that therapy could play.
Okay, I can
Go.
start. My role in this community, I found my way into this community after I wrote the Tactical Guide to Women, and that sort of that introduced me to this community. And that would have been around 2017, 2018, and I've seen tremendous changes in the manosphere. I guess everything evolves and changes, but my role, if I have a role in the manosphere, is simply to say, hey, here's what the research says, and here's how you might use it in your life. That's what the Tactical Guide to Women was. This conversation about therapy seems to me to be brand new. And I know that Anthony made that hat a while ago, the one that says "Make Therapy Great Again." But the conversation that we're having right now, I don't know that this conversation would have taken place 2 or 3 years ago.
No.
Or even, maybe a year ago, but certainly not 2 or 3 years ago, because it seemed like back then the conversations were dominated by some ideas about how women work. And it seems like a lot of people have said, okay, well now we got we got those ideas. Some of them we like, some of them we don't, but we're gonna move on and have different discussions. So I don't know, Ken, what do you think?
Gosh. So Sean, you're a psychologist, research. You kind of come at it from a different angle.
I don't do research, but
No,
yeah,
but you do
I read
read a
research,
hell of
yeah.
a lot of research.
Yeah.
You're really well read in that, and
Can't
that's what I
confirm.
really appreciate what you bring to the table. Where I bring something different to the table, where as an LMFT with marriage and family, it's more of a relational bent. How do we relate, not only with our women, with our family, with ourselves, relating it to myself. And so I think the relationship category, so I could bring something different to that. But I think being able to be in a space like this and have a voice that's really helpful, because I think, Sean, you bring something really significant to the table, and I know my voice of being able to talk about what are relationships and how do we actually do this, and how do we actually strengthen ourselves internally and psychologically and emotionally, I think are really powerful parts of becoming men who have a solid frame, who have internal confidence. And I think that's a really powerful part of this. So I think that's what this whole discussion is all about. Whether it's about, working out and doing well with our physicality, or making a difference in our community, or, a number of different things. Arthur's thing about art this morning was just profound about how that's such a significant part of our world. And I think how men become a profound presence in our universe, in our world, in our communities, in our families, I think is just a really significant thing. And I appreciate the fact that we're able to have a voice as therapists, as a psychologist, and being able to talk about these things. I think it's really phenomenal that we're able to open it up to a number of different categories to be able to have the conversation about what it means to be a man and how we actually strengthen ourselves and empower ourselves as men. I'm just fascinated by it. It's amazing.
Yeah, sort of a really natural broadening of the conversation from a lot of sort of foundational principles. Like, where can we take this? Maybe we can take it into therapy and families and faith and spirituality and some deeper ideas. Like, it seems like the possibilities have become almost endless kind of overnight in a way.
Yeah. And it's so gutsy for anybody in this realm to be having this conversation, because there is no reason any man should be trusting my profession right now. So, I mean, this is an incredibly open-minded conversation. And I think you all are to be congratulated. Tony, why do you call him? Anthony Johnson is certainly to be commended for bringing this up as a topic.
I agree. I mean, it's so vital for men to discover that, again, this is an equally valid form of work for other kinds of work that you can do for self-improvement. This holds just as much water, if not more. I mean, the progress that's possible, that became possible in my life after doing the work for a while, led me here to this stage. So I always like to invite men to consider walking down that road of therapy, of inner work, so that they can manifest the character and the man that they want to be and live the life that they want to lead. And that's sometimes only possible in conversation. Yeah. So as the space has kind of expanded into new realms, I think the men's space is kind of going through a shift, and new men are coming in as leaders. Like, how do you suss out like who's a good leader to follow? In a therapist's office, we talked about it earlier, but it's sort of in this men's space. How do you suss out like who's authentic, who might be a charlatan, who might be taking advantage of you? Like, what are some of the ways that men can look at a leader in the space and discern, like, okay, should I follow this guy or not?
I think for me, the category of setting you free probably determines that most significantly. So if you're working with somebody, you're reading about somebody, you're reading their content, you may be part of something that they're doing online. If their intent is setting you free to do the best version of you, to build the strength in you so that you can go and become and build and create your life and have a vision for creating the life that you want, and doing that. And I think that's probably the number one thing. But it seems like there's only a few. I think there's a lot of people you'll be involved with that want to do that. Go, be strong. Go, take care of yourself, take care of business, build your own business, make things happen. There's a lot of people like that. The ones that kind of lock you in and hold you into an ideology and hold you into this little system and keep you in this, locked into this, those are the ones to really watch out for. And that's, whether it's kind of cultish or whatever, I think that's an important thing just to distinguish. If they're setting me free, that's great. If they're locking me into something, that's not so great. That's kind of how I'd say it.
Yeah, I have a lot I want to say to that, but I want to get Sean's take on it as well.
Yeah, I would agree with that entirely. If they're making their message about their ideology, and of course the charlatans are always going to use the right language. They're going to say, "I'm here to set you free," but there's this little subtlety where it's about what I'm doing, not what not your life and what you're doing. And it's that me versus you dichotomy. I think when you hear these guys talking about saving lives, and I'm not talking about anyone in particular, because there's a lot of guys out there that are saying my system is saving lives, and I think, well, how narcissistic is that? Because I get that comment occasionally, because I've written some books, and someone will sometimes write to me and say, well, your book saved my life, and I take that for what it is, which is somebody saying, hey, thanks. It's a figure of speech.
For sure.
It can't possibly be that I saved my life for I saved their life for a couple of reasons. Number one, I've never written anything nearly profound enough to save anyone's life, and neither has anyone that I know of. But primarily, let's say that they mean it literally, that they're actually saying your book saved my life, just for the sake of argument. Let's say that they're doing that. And the answer to that is no. I'm sorry, but you're wrong, because the fact that you found something useful in my book means that you were looking for something. And if you didn't find it in my book, you would have found it somewhere else. You saved your life because you took control over your problem. You took ownership of it, and you went out and you sought something. Mm-hmm. And the guys that are out there saying things like, I'm saving lives, they're telling you that it's about me. It's not about you.
Right.
That is such a good thing. You're the one that's going to save your life. You are the one that's going to do that. That's such a good, I love that shift.
And there's something to that in therapy as well. Like when you sit down in the therapist's office, the therapist isn't the one actually changing your life. I mean, the therapist, and at least in my experience, the therapist is sort of a facilitator that allowed me to change my own life, my own story. Mm-hmm. The therapist didn't do anything to me, just gave me the possibility to, as we started out the conversation, to retell the story that I was telling myself, to tell it out loud for the first time, and then consider the possibility, giving myself options to retell it a different way. But it wasn't the therapist being like, you should tell the story this way. I got to decide how I told the story for the first time.
Yeah. There are very few people who get to say something like, I saved a life, and those people don't tend to actually say it, like an emergency room doctor. I was talking to one recently. And, that person, the reason I think they can say, I saved someone's life, is because somebody comes in and that doctor is taking ownership and responsibility for that problem.
Yes.
And that doctor is bearing the consequences of that problem. There are very few professions, therapists include, although psychiatrists and psychologists are sometimes in that position where we have to take ownership of a problem, but that's very rare unless you have a job that's specifically geared around that. So, anyway,
just something to be careful, like the guru mentality. It's like, no, it's about me,
it's
the
about
guru.
me.
Yeah, exactly. Versus you, the recipient of some information that's transformative in nature.
Yeah.
Well, I want to talk about science versus faith, or science and faith, because I don't know that they're necessarily opposed to each other, because I have the man of science and the man of faith, and I want you guys to just duke it out, so go.
Duke it out? This is awesome.
No, what I think is really interesting about your characters, I know you guys have been friends for a long time, and, as we said, Sean, you're really well versed in the clinical literature, and your Twitter feed, in addition to being absolutely savage, everyone follow @IronShrink on Twitter. He's great. But in addition to the takedowns of the APA and the ongoing commentary, you also reshare a lot of clinical literature, and what you write about it demonstrates such a strong mastery in the way that I can get it as a casual reader. Like, I can understand the way that you digest papers just in 280 characters or a thread or something like that. And then, Ken, you and I had a conversation in depth about faith and Christianity, and I think it's so interesting that you guys have been friends, and you have, at least to my surface observation, such different characters. And I think that there's a lot in this space around science and the impact that it can have in our lives as men, and how rational clinical data is important, and also the importance of soul and faith in the life of a man. So I just wanted to have that discussion for at least a couple minutes before maybe we open it up for questions. I don't know what to ask you about that. That's
I know,
the thing.
that's such a good question. It's an interesting observation that you have. Sean, what are you going to say?
Well, I wonder if there's a similarity between us. And like you say that you noted that I post sometimes research, and I'll phrase it in a way that I'm trying to distill what somebody else says, because academics, either they can't write or they feel compelled to write in a way that's inscrutable to most people, and so I will try to distill things. But I'm always wondering, am I really understanding this, or am I just really oversimplified, and like I'm kind of a dumb guy that's commenting on an article, and I'm never really certain to what degree I understand a paper that I'm reading. And Ken, I wonder if you're the same way with spirituality, that there's always a questioning and always a checking.
Always. That's one thing that I challenge my guys. I just say question everything. And that's what science does. It's interesting that is my type of faith is just question everything, question the narrative, question the stories that we've been told. And I think even thinking, I don't think it was you, I forget who we were talking about. I think it was Jeff. We were talking about Jesus and his parables, and how every parable that he ever spoke created way more questions than answers. And I think the whole idea of being a man who enjoys questions and questions reality and questions the narrative, that's actually science. That's what science does, is question the hypothesis.
Well, that's what religion does too. It's wrestling with God.
So here we
right?
are, Will. You're sitting there. You want Sean and I to duke it out. We're really good friends. We respect each other greatly. And I think that's what's fascinating about this whole thing, is you got people from all kinds of different backgrounds, traditions, and but we're all here for the same exact reason. We all want to empower men. We want to make masculinity be something that is set free, and we know that masculinity is the solution to a lot of problems. And so I love this, because it's like you're telling us to duke it out, and I'm going, we're not gonna duke it out. We're gonna just be good friends, because we can do that. Science and faith, we're right here together. It's awesome.
Yeah. Ditto.
Fantastic. Well, in that spirit, does anyone have any questions? We'll wait for the mic to come on.
Testing. Hello?
There you go. Yeah.
Yeah, great conversation. Really a lot of value here. So I just got a couple of questions. You mentioned something earlier that therapy is about reconnecting a man to himself. But I would sort of ask, actually, that's a great perspective, but generally speaking, what is the goal of therapy? How would you generally define that? And is there consensus within the field around sort of that goal or that definition? And then should everyone seek therapy? Because we all have issues. So does everybody need therapy, or who does and when, at what point?
Man, which question to answer?
Yeah, I'll jump in, because
Go.
I can be quick on this. Therapy should be about expanding your options. It should be about taking you off autopilot, because by the time we're adults, we're all on autopilot to some degree. Therapy should be about turning off the autopilot, and maybe what you're doing is working, maybe it isn't, but let's make it a conscious decision rather than an automatic one. And then, what was the second question?
Should everyone be in therapy?
No.
That was a fifth.
No, I don't think so. I mean, some people, things are going great. Got a good job, got a good marriage, you're happy, you're healthy, everybody's well adjusted, everybody's functioning fine. Why not just enjoy that?
Yeah, and I'd say a lot of times our issues, problems, we can resolve it with good conversations with good friends. We can resolve it with managing things or exploring things with our faith, of being able to really work with our spiritual community. I think there's a lot of things we can resolve without therapy. There's so many other resources. And your question about the whole thing of connecting a man to himself, I think that is primarily one of the most important goals of therapy, because once you're able to become, connected from here and my body and all the different categories, once I'm able to be connected, I can start at that point to start to resolve a lot of different categories, a lot of problems, a lot of issues. I can find wisdom, I can find direction within, and I have more of an internal frame of reference. and I'm able to actually explore and determine the direction of my life.
Outstanding. Thank you for your question.
Hello.
Hello.
Throughout this, while I'm reading my notes, I hear a recurring theme: narrative and developing language to describe experience. And I mean, I've had my share of therapy. I can tell you all kinds of fun stories about waking up in the middle of the night screaming and my neighbors are calling 911 because they think I'm being stabbed to death. It's been a blast. Journaling has been a good thing, but my mind keeps coming back to this. Developing the vocabulary and the language to actually describe experience and identify its relationship to our behavior, in my experience, is challenging. And I was wondering if you could propose tools, activities, something that might help us to get our heads around it, to bring it from that intuitive nonverbal into the verbal level. If you could speak to that, I'd appreciate it.
Sure, I'll say something real quick. Gosh, the nonverbal stuff, we were talking about that earlier, and our friend Allison Armstrong, she will talk about how a man's mother tongue is nonverbal, right? And how you think about this with little boys. If any of you had little girls and little boys, your daughters, your sons, you know that the little girl speaks, she starts talking like crazy. Most little boys are grunts and grinds, and if women were here in the crowd, one of the funniest things is if I talk to you guys about doing sound effects, every guy in here could do 1 million sound effects. Women can't do them, or most women cannot do as many. And because we grew up on sound effects, we do the bombs and everything, machine guns and cars and trucks and horns and whatever, and squeaky wheelchairs, scooch, 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 scooch. And it's funny how we just know how to do it. Nonverbal is our mother tongue. And so, to that question, putting it into words, here's the thing. I believe, and this is part of my spirituality, is from my Christian faith, from the beginning of time, in the beginning, God spoke everything into existence. He used words. He used his voice, and he spoke it into existence. That's how creation happened. And then if you think about it, in the beginning of the New Testament, it says, in the beginning was the Word, and the Word was with God. That's in reference to Christ. And so the Word's created, the Word is Christ. And so however this plays out, the whole idea of the magic, the brilliance, the spirituality of words and vocabulary, you use the word vocabulary, being able to put our experience, put what's going on with us into words is more profound than you might ever realize. So as men, since our mother tongue is nonverbal, being able to take this nonverbal stuff that's going on and putting it into words, whether that's through talking to somebody in therapy, journaling it, praying it, however we express it, being able to put it into some kind of language and into words is incredibly profound. And it's an incredible part of our journey as men to become strong and to become understanding of ourselves and to become able to connect to ourselves.
Yeah, I would echo all that, in particular the journaling part, only because I've known so many men who've made it a practice to journal, and it brought so many things into focus for them. And it's not for everybody, but if it's for you, it's a wonderful practice. It takes discipline. And another way to start putting a specific technique, to start putting words to experience, is to develop some kind of practice for just observing what the mind does. And that could be like a Buddhist practice, some sort of religious discipline, or it could be, there's like acceptance and commitment therapy. There's a book called The Happiness Trap that is a great introduction to the more scientific side of observing your mind, because when you observe your mind, then you can really step back from what it's doing and not be so emotionally invested in what it's doing. And so there's a couple of good basic techniques, along with just talking to people, talking to your buddies. So
Yeah.
Thanks for your question. Go ahead.
Thank you, guys. Will, I'd like to give you space to talk about the distinction between feeling and emotion. And then I think you understand by what I mean by that.
Yep.
And Ken, I'd like to see, you mentioned a lot about the feelings in the body. And I want to know, what is the extent of processing those feelings? when is it too much? When can a man in therapy just start swimming in too many emotions?
Mm-hmm.
And when is the cup full? You know, if you're going to process fear, is the vessel empty? Are we done yet? Or what does that look like?
Mm.
So one of the challenges of the English language is that we mix up the notion of feelings and emotions, and that in some sense they're different things. So sadness is an emotion, but we say I feel sad, right? And so I don't emote sad would probably be a better way of putting it, versus a feeling, which is like, it's almost like an intuition. It's almost like a nonverbal sense. It's trying to alert to something perhaps going on in the environment, perhaps going on in the internal being. Now, I'm not a clinician. I'm not professionally trained. I'm sure that both these men can speak far more eloquently and with far more experience than I can about it. But in my experience, learning to separate inside myself between a feeling and emotion has been very valuable. And so the distinction that I've drawn is a feeling is something that's going on inside my body that I can use as information. I suppose the emotion can be this as well, but I can use an information that can still be processed in a rational way. Sort of like, well, what's going on? My intuitive sense, my feeling about something, right? Versus an emotion is an experience of overwhelming energy. It doesn't necessarily have to be overwhelming energy that is similarly trying to alert me something that perhaps can be far more serious about my experience. So a feeling might be something more low energy, and an emotion might be higher energy. Both are sources of information that can be very valuable. But an emotion is sort of like a more, this might say, full body kind of experience. And I don't know that I'm articulating that as clearly as I have in the past, but that's kind of how I draw the distinction between those two things, just to separate the ideas that you can have a feeling about something and an emotional experience is very different. And maybe you two can speak about it from your own experience.
Well, I wonder if answering the second part of that question, the whole thing of how much is too much, and I don't ever think that we're for some reason, it feels like that we're able to process this stuff in the time that it needs to come out. And so I haven't seen where it's too much. But I'm not sure this is exactly what you're talking about. But so often, and this was my case, was that I had stuffed my emotional process in my life so much that I had stuffed that energy and stuffed that, and I never took care of it, never attended to it. And it's as if, and some people would talk about it as being energy just packed into you, just kind of stuffed and stuffed and stuffed. And so when we start talking it out and we start processing it, it's like little by little this stuff keeps coming out. And it's packed in there. It's really a lot of energy packed in there. And so it'll come out in tears, or it'll come out in anger, or it'll come out in intensities, and different things like that. And it's like, and it's a season. It could be a year, it could be 2 years, but it takes time to be able to let this stuff out and move it out. I remember I had a whole season where it was like, one time in particular was just this cathartic moment in my life where a ton of this just came washing out of me, and it felt like too much. I remember it was at an event, and it was about my father and the cowboy stuff. Mm-hmm. That was the big deal, man. I was telling Will this little bit of the story the other day, and so the category of it just washed out of me, and I was crying so much that my nose was snotty, and my nose, I was just could not hold it in. It was pouring out of me, and my nose, I went to the bathroom to try to clean up, and my nose started bleeding, and it was just, I was a mess. Mm-hmm. But it was this energy about my father that had been released, and it had moved out of me. And so this is how it works. And sometimes it feels like too much. Sometimes it feels like a season where, oh my gosh, is this ever gonna end? But as you process it, as you move it, as you'll talk it out, as you speak it, as you name it, all these different things, it starts to move out of you. And eventually you get to a place where you go, I don't feel it anymore. It's not in me anymore. And now I can actually deal with stuff in real time as it comes up. So that's a really, really profound thing. And I know we're out of time, mm-hmm. and so I don't know what we need to do to...
We'll give Sean, you want to take we have a couple minutes left if you want to just take a minute to answer that from your experience, if you'd like to. Otherwise,
Feelings versus emotions.
yeah. And is the
Yeah.
vessel ever empty? Is also one of the questions in there as well.
Yeah, well, I'll start with the definition of emotions. It's those basic emotional experiences like happy, sad, angry, feared, full, disgusted. We categorize them under the heading of emotion because they serve the same purpose of either moving us towards something or moving us away from something. So a lizard has feelings. That's how it knows how to move toward something that is appetitive and away from something that is aversive. But then feelings, that gets so much more complicated because then that implies to me that we're taking those emotions, those basic emotions, and we're piling all kinds of human ability to attach words and meaning and symbolism and history. And I don't know if it's I don't know what too much means.
Mm-hmm.
Yeah.
Are we capable of feeling too much?
Are we capable of feeling too much? I don't know. It's not like our brain is an engine and you can redline it and throw a rod, if that's what you mean. I mean,
Sure.
There's this theory called the Spun glass theory of mind. That it's a very old idea that our minds are so fragile that we cannot tolerate anything that's uncomfortable, and that seems to have taken over our society, that idea. But the original Spun glass theory of mind was that it's a stupid theory. Like our brains can't break from too much emotion or too much thinking or anything really. Now we can, obviously we can be traumatized in a clinical sense, like to where we start having highly heightened anxiety responses and so forth. But just thinking and feeling, no, you can't really break your brain. In fact, one last thing. People sometimes get into anxiety cycles where they do feel like they're starting to go crazy, whatever that, like if there's a condition called depersonalization where you start to feel like you're observing yourself from a distance and you feel out of your body. And people will experience this and feel like they'll worry that they are actually losing their minds and it's going to degenerate and they're going to end up in a rubber room. I don't know what the fear is. The fear usually gets very catastrophic but very vague. Like they don't know where it's going. They just know it's going nowhere good. And part of the cure to that is essentially at some point you start challenging yourself as you're challenging the dangerousness of this, because it's not a dangerous thing, but as you're challenging the idea that this is dangerous and this is going to hurt me, eventually you get to the question, okay, let me try to go insane. Let me try to actually go crazy and see if I can do it. And of course you can't. So I don't know where I was going with that.
No, it's fine. And
Yeah.
for me, the question is the vessel empty? Is, it's sort of like, what is the vessel? How much of the vessel is me? Where do the boundaries blur between me and my family history? If you want to get into things like past lives or theological, spiritual aspects, is the vessel ever empty from a personal standpoint? Perhaps, perhaps not. But once you start expanding the sense of self beyond the individual, then the question gets a bit more fuzzy. So we'd have to define what the vessel is, which would be a question for another time. So this is a wrapping. Oh, sorry. We have one more question? One more question. Okay, cool.
I think you may have addressed some of the points in my question already with the verbalization piece, but are there any resources like books or videos or podcasts or activities that you would recommend for men to do at home that address common issues you see, or that perhaps provide a foundation, emotional foundation that might minimize the likelihood of therapy, with the caveat that there's no substitute for therapy? I'd be curious to hear if there are some activities or resources you'd recommend for any man in these difficult times.
I can start with that.
Go.
Yeah. So Ryan Mickler talks a lot about how men can learn to work with their emotions, that you can experience an emotion without acting on it. So an emotion comes up in the moment, it becomes quite powerful. This is if you're alone. And obviously in the therapist's office, it's going to be very different. In a men's group, it would be very different. But in, say, the privacy of one's own home, or perhaps even in public, an emotion can come up. And to look at the emotion as information and to experience it and to hold it, and then in my experience, to allow the emotion to subside to the point where, okay, I've got this under control and now I can act. And not to take emotion as something that I must act upon immediately. And that can be very, very important, because sometimes acting out of emotion can cause men to do things that are uncalibrated. Now, certainly it could be necessary in some circumstances to act on emotion. For example, anger. Someone's coming at you trying to harm you. When you feel anger and you act in response, not to say, but there can be other situations where something innocuous can cause anger and be like, I'm feeling anger right now. This is anger. I'm going to sit with it until I can speak or act in a calibrated, rational way, and to learn to work with that process. Say, I don't necessarily need to act on this emotion. I can experience it, and once the energy subsides, then I can speak or act. And that's a very, I find, a very wise way of working with emotions, just in private, to allow them to not suppress them and to not act out on them, but to simply experience them. And that can be done with practice. So that's my answer to that question, if you guys have some as well.
Yeah, I can jump in. I think there are obviously myriad resources out there, video, books. You'll never run out of resources. But then you get into the question of quality control. Like, how do you know that what you're stumbling across as you're looking for information is actually going to be useful? And I think one of the most important ways to vet the information that you are taking in is to run it through the filter of, is this idea or this framework or this information, is it challenging me to examine what I am doing to create my outcomes? Or is it just putting the blame out there on women, on society, on mommy, whatever, on Joe Biden, whatever? I think that's probably one of the most useful filters to try to do some quality control there.
Mm-hmm.
Awesome. Thanks, guys.
Yeah, thank you. This is the end of our live stream. I think if you guys don't mind sticking around for some additional questions, thank you, Ken.
Yeah, thank you, Will.
Yeah. Thank you, Sean.
My pleasure. Thanks for having me.
Yeah. This is Will Spencer from the Renaissance of Men, here with the Red Man Group and the therapists. Let's make therapy great again.
Welcome back to the 21 Convention Second Patriarch Edition, live in Orlando, Florida.
Welcome to the 22 Convention.
Welcome back to the 21 Convention 2020 of Orlando, Florida, being held for the first time ever at our very first and inaugural 21 Summit event. Welcome to 21 Summit in Orlando, Florida.
Well, here we go. We risked again with the 22 Convention, the Patriarch and 21 Convention, all three stages together in one event.
Not only did we sit down and say we're going to come together and meet in mass, but we're going to take it a step further. We are going to dare have a conversation about the sexes openly, honestly, and engage the women that.
Like, I am amazed at how well this went. We did a brand new event, we did the second Patriarch, and we did the main event for the 19th time.
It's so much more than sitting in an audience watching a man on a stage. The conversations in the hallways, the connections that people make, the challenging, the collaborations.
And that's what we need. It all starts with men. And it's not just men. That's what I like about this. You know, we don't want to like overreact to feminism and then hate women. That's not it. This is about men getting their act together, doing what they're made to do.
You had meals, you had to run security, you had to run travel plans, you had to ensure people were where they needed to be. 3 stages, cameras everywhere, and it was pulled off with flawless execution.
It's evolved so much. I really appreciate how Anthony has allowed you speakers to evolve and to grow and to share that and to encourage that with all the other men here. To hear so much talk on family and fatherhood, there's more depth, there's more room for who they could be.
Is the word patriarchy or patriarch offensive to you in any way?
Not to me personally.
Okay.
Not at all. It's something that I cherish it. I love it. I grew up wanting
cherish the patriarchy.
I do.
In mansplaining news, a 3-day conference for women led by men hopes to make women great again.
Well, women need to be taught how to be great again.
Oh,
Not my words.
We do. Like how to land a husband, how to lose weight, how to pop out a bunch of kids.
Why do men think they need to fix the problems of women?
Well, it says the world's ultimate event for women.
In Orlando, Florida, that's going to be the scene of the crime. It's mansplaining palooza. You say no to the toxic bullying feminist dogma.
Patriarchy is the future.
it's good to see it in person. Until I got here and saw it, and you can see the people in the audience, you see the men that are here committed to listening. I mean, it's just changed my idea of what the conference is. The professionalism, the staff, the way everything is organized, it's given me a different perspective about this particular idea, and I'm ready to put some more fire into it.
Welcome to Dream World, ladies and gentlemen.